Combating Obesity, Community Health Risk Assessment Proposal. Introduction. The activities of the community under consideration are aimed at combating obesity among the population of different ages. A theoretical approach to solving the problem and helping patients is valuable because of a large number of useful resources. The possibility of involving representatives of the healthcare sector opens up broad prospects for effective interventions. Some barriers can hamper community work, however, risk assessment can help to identify key areas for development. Health risks. Health risk assessment of the population that is the target group of the study can be performed based on a special methodology. Gordon provides the framework that makes it possible to analyze health samples. The features of this model can be applied in the context of the community's anti-obesity activities. To do it, it is required to evaluate the different signs and symptoms of the disease, track potential deviations from anticipated norms, and make a verdict regarding the possibility and effectiveness of the intervention. If this cannot be achieved, additional clinical studies should be conducted. Useful resources. To conduct a full evaluation of the community's activities, attention should be paid to some sources that can be used. Firstly, it may be patient outcomes and the results of successful interventions. Secondly, the information from professional medics participating in community activities may be useful for assessing the work of the group. Thirdly, academic literature and other available means of obtaining theoretical knowledge are indispensable elements of work. Analyzing all these data, it is possible to draw certain conclusions regarding the effectiveness of the community's work. Community's strengths and concerns. An example of any community's strengths can be a large number of successful interventions. According to Harris, knowing the effectiveness of a particular program, it is possible to draw competent conclusions regarding its relevance in a certain field. Nevertheless, some community concerns may manifest, for instance, the inability to assist particular members of the group due to attendant factors. This problem is relevant if the patient has non-standard symptoms that require additional diagnosis. With regard to the obesity prevention program under consideration, its strengths are the relevance of the work being done, as well as many proven cases of successful interventions. From the point of view of concern, the inadequate filling of the community by medical specialists can adversely affect the quality of work. To avoid problems, it is essential to involve professional medics in the group to help those in need. Potential barriers and the ways to address them. In the process of realizing the community plans, some potential barriers may arise. Rubio-Valera et al. Mentions such a challenge as an insufficient qualification of the nursing staff. It can be a problem if community members do not have the desire to develop professionally for better results. The author also mentions insufficient provision of the necessary equipment, which can also affect patient outcomes negatively. If the target population does not have specific means to monitor their health indicators, there will be difficulties in analyzing the results achieved. However, in the first case, the problem can be solved by discussion and assistance to employees with insufficient qualifications. The issue of the lack of inventory cannot be addressed through brainstorming. Therefore, the search for appropriate funds will need to be performed if there are difficulties in providing patients with the required equipment for quality medical interventions. Conclusion. Despite potential barriers to community work, timely risk assessment and the discussion of problems may help to achieve quality patient outcomes. Several useful resources may assist in providing sufficient care for people with obesity. The community has certain strengths, but some concerns need to be taken into account.